What has been the impact of like the ablation confirmation specifically on your practice and your patients?
I think, I don't know, every case should be an A0 ablation. Like really shouldn't do any ablation unless you're going to be able to get the whole thing when you're trying to do these curative type procedures or these procedures where you're trying to remove tumor versus palliation. So if your goal is to get it all the first time, you really have to get margins. In order to get margins, you have to look at them. And so for me, the availability of AC has allowed me to look at my margins and look at my treatment effect real time in the room while they're still asleep, and to be able to provide a more complete treatment the first time so that you're not coming back. I don't think I had a really high recurrence rate before, but there were obviously recurrences. If you follow someone 12 months, 18 months, 24 months, those are the ones that you're really trying to prevent. Every ablation looks good at 3 months,
Sure.
But when you follow them long term, that's when you're really going to pick them up. And I think that since I've started using this, my recurrence rate has been very low. I think even when I've been able to say, hey, look, we got the margin there. We did everything we could to do this the best way we knew how to do it. And so it's given me more confidence in ablation. It's made me actually faster in the end because I've been able to adjust the way I do things because of the kind of experience I've gotten from looking at my zones and being like, oh, wow, that was an undercooking, or that didn't need to go that high. So
Sure.
It's made me better at doing the procedure, knowing what I know from that information. And then it's nice for practice building. I have to say, I take screenshots every time, and I take a picture of it in 3D, and I send them to my referring providers, and I say, hey, case went great. Here's some pictures, got a nice margin. Thanks for the referral. I'll continue to follow. And I send that same email trail at 3 months, in 6 months, in 9 months. And so for practice building, that's huge. They know that I'm doing the same things that they're doing if they're a surgeon in terms of ablation. And they know, it looks very similar to like a rad-onc picture where they're able to show those at tumor board and be like, oh, here's our dose plan. We're like, okay, well, here's my ablation and my margins. And it looks great. And it's sexy, and to be able to look at a lesion and see it and know that you got it, it's hard to ignore that when you show it to somebody.
That's awesome.
And so it's powerful for practice building.